All right. So we have 3 motions we're going to measure, and those of you who are behind Ryan will not be able to see them. Preston, you did triathlons.
I'm moving.
I
didn't even make a face.
You did.
My nonverbal was good.
I heard you.
Nonverbal was great.
All right. So we have 3 motions. One of them is going to be depression. So it's opening your mouth. So the next one is protrusion, and so that's going to be taking the mandible and protruding it forward. Okay? And then the second one, or the third one, is lateral deviation, and you'll measure that to the left and the right. So when you're doing the lateral deviation, you want to make sure that your teeth stay as close as possible so that you're not opening and then you're not combining motions, okay? And what we're going to do for the protrusion and the depression is simply put this on the top teeth and then measure that distance in millimeters again, or centimeters to the millimeter, okay? And these are all done actively. Hi, Ryan.
Hey.
How are you doing today?
Well.
Did you have a great weekend?
Yeah.
I really like your shoes.
Thank you.
What I'd like you to do is, I need to measure how far you can open your mouth. So what I'd like you to do is open your mouth as wide as possible. Good. Good. And relax. So we are at, oh, Lordy, right at 4.0 centimeters, of course. All right. So then for the next one, we're going to do protrusion. Now for protrusion, we don't want to keep the goniometer this way because it'll press on the lips, so you want to have it this way. Now for some of you, the lips won't be out of the way. Ryan is doing a nice job. So you may have to either ask the patient to pull up a lip or down a lip, or otherwise you can do it, okay? But so now what I want to do is measure how far forward you can jut your jaw. So you're going to go, nice. Good. I didn't put my hand in a very good spot, so that was 6 millimeters, so 0.6 centimeters.
Are there norms for these?
No, there are no norms. Thank you for asking. Now, for the lateral deviation, you want to make sure that the top teeth and the bottom teeth align, okay? If they don't align, you want to take that into account when you measure. So again, we're looking, the top teeth are our reference, and we're looking to see how far the mandible moves. So if the bottom teeth relative to the top teeth at rest are not aligned, and it's shifted in the direction that you're measuring, you would subtract 1 millimeter or 2 millimeters from that number. If they're aligned in the opposite direction that you're measuring, you would add those 1 to 2 millimeters of that deviation. Is everyone clear as mud? Okay. So, are you clear?
Yeah, so I can either push down on my molars, or I can like push down on the front of my teeth? Which one?
So you want to go ahead, whatever your natural overbite or underbite is, you want to leave that.
Got it. So that's like this.
Although Emily EE has a cool party trick regarding her under overbite. So what you're going to want to do is just have your jaw relaxed. And what I want you to do is just slide over. Okay, good. Can you go back to relax for me? I didn't check to see. Oh, look at you. So Ryan's just a little bit off on his top teeth, or a little bit in the direction we're going to move. Good. So we were at 0.7 centimeters, but he's 1 millimeter off, so it would be 0.6 millimeters lateral deviation to the right.
What are you measuring?
Are you measuring the split
Deviation.
on the top versus the split?
I know.
Yes. And if they don't align, you have to compensate for that.
Wait, how do you tell if it's aligned?
Okay.
Are you measuring the cracks?
Like the
Yes.
between the middle two teeth.
I think so. Parents
So,
get a lot of money.
Ryan, this
In the
is
middle
no
of the teeth.
reflection of your teeth.
How's mine?
Race face.
Yours is good. Mine's good too.
Yeah.
Mine's good too.
Let's see. Oh, I'll have everyone agree.
Definitely doesn't.
$6,000 later, better be for good.
How many years ago?
No, that was money.
Oh, $7,000. You said.
When did you get yours off?
I only had them for 2 years, but my teeth were jacked because.
So here, these align,
So
okay? And so we're measuring the distance from here to here. Okay? Now, if these were offset a little bit to begin with, and this was 1 millimeter. Okay, if I had him going, so if we're looking at this person, if we had this person go this way, this person's already shifted over a millimeter, so we would need to subtract that millimeter for going in the right direction for this patient. And going this way, this person's shifted the other way, so now we need to add that 1 millimeter to the measurement going this way. Okay? Alright. Okay, that's it for TMJ. So you're going to document resting bite similar to how you would have documented carrying angle. So this is really explaining the person's resting position. So here you're looking at their resting bite. So you're simply going to be putting your tape measure or your goni on whatever, either the upper or the lower, depending if it's an overbite or an underbite. Resting it on the most posterior tooth and then just measuring the resting distance between the two teeth. So an underbite is, right? And an overbite is, okay? So that these are all on video. So if I was documenting this, if in the natural position, if the teeth align, that would be 0 centimeters, so that would be a neutral bite, right? An underbite is going to be that the, I have those wrong, shoot. So, yeah, so an underbite, if this is neutral, and we're comparing what the mandible is doing, if we have an overbite, can you turn this off?